Welcome, everyone, and thank you so much for joining us for this important session on being safe through this pandemic. My name is Jessica Collins, and I'm the Executive Director of the Public Health Institute of Western Mass, and I want to thank everyone behind the scenes who has helped put this important session together. Thank you so much, first of all, to our experts and trusted community members who have joined us today, different ages, cultural heritages, expertise, and hometowns, who will talk with us about the flu shot, wearing your mask, celebrating Thanksgiving, trusted sources of information, and getting tested for COVID. I would also like to thank all of you and give a shout out to the local and state officials who have joined us. We appreciate your leadership, and we have several who will be sharing personal messages later, and I will just introduce them all then. Thank you all. Now it is my great honor and pleasure to introduce these panelists who have been working tirelessly on the front lines for months, caring for our loved ones despite the risks to themselves. Each of them will have about 5 minutes to share on the themes before us today. And then we will have a question and answer session, which many of you have already sent in questions, which we appreciate so much. Our first speaker is Dr. Esteban del Pilar Morales, infectious disease doc at Bay State Health and Caring Health Center. He received his undergraduate degree from the University of Puerto Rico in industrial microbiology, as well as a medical degree from the University of Puerto Rico Medical School, and subsequently did residency in infectious diseases and tropical medicine fellowship at the University District Hospital in San Juan. Dr. Pilar has lived in Massachusetts since 2014 and holds an assistant professor of medicine at the University of Massachusetts Medical School, as well as serves on the Commission for the Board of Health in the City of Holyoke. Dr. del Pilar, welcome, and please share with us what you're feeling right now with regard to COVID and the best safety for us all.
Okay, so good afternoon to all. Like Jessica said, my name is Esteban del Pilar. A lot of my patients just call me Dr. Esteban. It's much shorter and simpler to say. So over the past few months, we've been dealing with this pandemic, and it's been hard for everyone. From us as doctors in the front lines, working with patients, and sometimes limited resources, to the community as a whole, because this thing has truly changed our life. How do we interact with other people? How do we do our job? How do we even go grocery shopping? So now that we're getting into this time of the year where, holidays are coming and we're having Thanksgiving in a few days, it becomes very important to have that sense of community and family. And it's in these moments that we have to be more conscientious about what the virus represents in our day-to-day lives. I can understand that people are tired, are scared, and are sick of, do I really have to wear this mask? Do I really have to stay away from my grandfather that I haven't seen in 3 months? And yes, it is very troublesome, and it can be burdensome at times. But I tell people it's better to have a little bit of burden now than to deal with the loss of a friend or a family member later on. Obviously, at this time, it kind of collides with the flu season, and we are going to have a little bit of mixture of both things happening at the same time. So it is important that we address one and don't forget to address the other. I can tell you right now, as an infectious disease attending here at Bay State, we see these patients coming in, and we can see the numbers going up. And I think that this is one of those times where we have to be prepared to make the sacrifices so we don't create bigger sacrifices down the road. Wearing your face mask, cleaning your hands, staying socially distancing when you can is important. And when it comes to the flu, I tell people, we know a lot about the flu. We've been dealing it for decades, centuries even. And, we have really good vaccines. Here in Bay State, they give us these little stickers when we get a vaccine. I said, you see, mine is the letter with all the little stickers of when I get mine. And I tell my patients, I get it because I want to protect you as my patient, and I want to protect my family when I go home. That's one of the tools that we have to do this. The other thing that we can do is make sure that, we clean our hands and social distance. What we're doing for one virus works for the other. And it's important that we keep this in mind as we move forward and understand that yes, the holidays might not look that great this year, and it might be a little bit different than it was before, and we might be a little bit sad, but I tell people I'm sad that I'm not going to see my mother for Christmas this year, but I'm happy that she'll be alive and healthy for me to see her next year. So I'm not going to talk too much because my wife always says that I talk too much, and leave enough time for other people to have their say as well, and obviously invest more of that time in questions. I think that that'll be more worthwhile. We need to be aware that yes, this is a tough time, but we are tough people, and we will get over this as long as we follow the true road of science and facts.
That's so great. Thank you so much, Dr. Esteban. I will call you that if you wish. And I just love the humor because, of course, humor is absolutely also what we need. So thank you for those thoughts. I'd like to now introduce Nurse Magdalene Iboso, Maggie, she's known as. She is an infectious prevention and control coordinator at Mercy Medical Center and Providence Behavioral Health, a member of the Trinity Health of New England. In this role, she works closely with hospital management to ensure all infection control incidents are investigated and resolved, develops action plans, and updates policies to reflect any needed changes. Nurse Iboso has 15 years of nursing experience and is certified in infection control. She holds a nursing degree from Springfield Technical College and Jacksonville University, as well as a master's degree in nursing and business administration from Elms College. So thank you so much for joining us, Nurse Iboso.
Good afternoon, everyone. Thank you so much for having me, and thank you truly for having this event, because it feels like, in as much as there's a lot of information, as much as almost we've been in this battle for a long time, there always is a need for really accurate and proper information that could be had. When January rolled around, I think all of us were hoping for something different. And then as it unraveled, we all realized we really needed to brace ourselves, pull our sleeves up, and really be ready for battle. It came initially, obviously, there was a lot of fear because we didn't know what this was all about. And it didn't help that all of us were inundated with a lot of information, different type of information. And it just felt like it didn't jive. When you went in front of your colleagues, like in my role, primarily, I'm supposed to teach people about the PPE and get in front of that message every day because it was changing constantly. Because in any case, when it first showed up, they were calling it novel because it's new. We didn't know much about it. So when we showed up in front of people and told them, hey, all you need is this type of mask and this gown. And then when they watched the news and they were seeing people in hazmat suits, it didn't really sit very well with them. And they were all looking at us like, are you sure? Are you sure we're going to be able to do what we signed up to do? Because let's face it, we're all healthcare workers and we all signed up to do this. We all came into this business knowing that, yes, we want to care for our patients and then be able to go home. So my number one priority in any case regarding COVID was making sure that all my colleagues, from the physicians to the nurses to the respiratory therapists, the diet aides, could come in, do their job, what they love, and then function, and then appropriately go back home to their families and loved ones. It has changed constantly. And the real substance of it all is trying to tell people, I totally understand. This is what we told you yesterday, and this is what we're giving you today. So it's the same thing. In as much as we share that as healthcare providers, when we come to you and when we come to the public at large, our family members, we have to sort of really give it our all and make them understand this is what we shared yesterday, because we're learning something about this every day. I know people now are hearing, hey, can I just get a test and then go for Thanksgiving? The college kids who want to come home, they've been gone for 3 months. And we want everyone to understand it is such a multifaceted issue that we're dealing with. Like, there is not one sure way to deal with this and fix this and say, hey, I got tested, now I can go party because my test came back negative and I'm good to go, and life is ready for me to take a roll. No, it's just testing is one layer. There's more to it. There's more, because if I get tested today, that's giving me a snapshot of 2 weeks ago. What about tomorrow? What about yesterday? What about, all the other different people that I have come in contact with since I got last tested. And then people are so afraid of one piece, but not the other. And it's really important for us to, as healthcare providers, as community leaders, to make sure that everyone really understands. There's going to be so much information. There's going to be a lot of inundation with everything that people hear. But the few true things that will stand this test of time and stand everything. Wear your mask, wear it well, wash your hands, wash them often. And those cloth masks that everybody's wearing, wash them too. Because like everything else that we wash, right? Our clothes, our dresses, how is it that that face cloth mask that I'm wearing, I'm going to assume that, yes, it's protecting me, but 2 weeks later or 3 weeks, I never thought, oh my God, I need to wash it. So I understand that every day there's something new or something we hear on the TV and we're like, wait, a minute, that's not what they told me, or this is different from what they said yesterday. You all need to make up your mind because it sounds like you're telling me something different every day. Please bear with the science. The more we learn about it, the more we come up in front of everybody to tell them what it is that we know. And clearly, if you listen to all the experts and the scientists out there, they will constantly say, we're learning more about it every day. And this isn't going to be any different from, think about polio, think about TB, think about how long did we have to learn the science and improve on it, and the vaccines. Granted, these are things we're developing on the go, really, as we are understanding it. So hang in there. I know sometimes we feel like, this battle fatigue, and I just want to have Thanksgiving. We locked down for summer, and here is Christmas and Thanksgiving, and you're going to tell us that we can't do that, what we want to do, like everybody's like fed up and had it. Trust me, like Dr. Del Pilar said, he will definitely miss his mom for Christmas, but you know what? There's many more Christmases that are going to come. I have little ones. I have 4 kids, and I want to be there, but I want to dance at their weddings and their grandkids' weddings, Granted, my youngest is 5 years old, but some ways to go, but I'm excited just to learn what the science and what they're unraveling every day. But I want to hope that all of us can confidently be the face of the clarity. Whatever needs to be demystified and whatever needs to be clarified and put out, I want to be a little piece of that. And if somebody somewhere today listens to this message and is staying safe, think about that contact tracing. That's 30 people that by staying home protected them from getting it. And it travels very quickly. So please take it. Please be patient, and there'll be better times, like this too shall pass. So thank you.
Thank you so much, Nurse Iboso. That was terrific. And thank you for taking care of those healthcare workers inside those hospitals. Our next panelist is Dr. Siobhan McNally. She is the Chief of Pediatrics and Director of Pediatric Refugee Program at Caring Health Center. Dr. McNally is a graduate of Yale College and holds her medical degree and her MPHA degree from University of Massachusetts. She did her pediatric residency at the Massachusetts General Hospital and Boston Children's Hospital and has spent the bulk of her career caring for underserved populations both in rural and urban areas, both in and outside of the United States. So thank you, Dr. McNally, for joining us. Love to hear your thoughts.
Hi, everyone. Thank you so much for having me here and sharing my experience as a pediatrician. I'm going to be echoing a lot of what has already been said, maybe with a little bit more of a pediatric, slant on things. But generally speaking, it's the information is very consistent with what's already been said. I've been in practice for 35 plus years, and I would say that this pandemic stands out as one of the most challenging times families have faced for a couple of reasons. As deadly as COVID-19 virus can be, it's also stealth. You can't see it, you can't smell it, you can't feel it, even when it's close. And so as this pandemic drags on, I think all of us really need to remind ourselves, including myself, every day to be on high alert, and not to let our guard down. And because in a way, I think each one of us, we have to think of each one of us, including our children, as warriors in this fight. right? And we're depending on each other to keep this virus at bay. So here's the things that I share with families in my practice that I think will help protect you also and your kids. And they're the very same things I share with my family. First, get accurate information. I think so many people are getting misinformation, and I think the first thing we need to do is just make sure that we're basing our actions on the most accurate information. For a lot of us go to the Massachusetts Department of Public Health, the CDC for that information. As a pediatrician, and I think if you have children, one of the best resources that I go to is called healthychildren.org. That's fueled by the American Academy of Pediatrics, and it's both in English and Spanish, and a lot of family-friendly information about COVID, and it's always updated and very accurate, and it's practical. I think, like the two speakers before me, I urge everyone to limit in-person celebrations for this holiday to immediate household members. Again, this virus is stealth. So even a negative COVID test can be very misleading, right? You can be negative one day and then the very next day be positive. So please stick with the guidelines, celebrate in person with household members, and then, like Zoom, your relatives. I'm going to be Zooming my first grandchild. So I start crying when I start thinking about it, but that's the most important thing to do. Because again, I want to be able to celebrate Christmas and next year with her. Wear a mask whenever you're in a public space or you're with people outside your household. And the mask recommendation includes children over 2. And I know sometimes it's not easy, to get kids to wear masks. Sometimes they're scared, but the Academy of Pediatrics has some really great tips about ways to overcome the reluctance. And again, those are on healthychildren.org. And then the other things that again were echoed, before me. Wash your hands with soap and warm water, stay 6 feet apart from non-household members, and then open windows whenever you can. I think the more ventilation, the better. If you or your child have symptoms of possible COVID, cough, fever, body aches, loss of smell or taste, assume it might be COVID. Okay, yes, it might be just a regular cold, but just assume that it might be COVID. Stay home and call us, for advice. I think also specifically for children, be mindful of MISC. It's MISC. It's short for multi-inflammatory syndrome. It's very rare, but it's quite serious, and it's a condition that children can get about 4 weeks after having COVID. And that manifests in a little different way with fever, intestinal symptoms like diarrhea, abdominal pain, rash sometimes, heart problems times. And that can be quite quick in development. So like if you do start seeing these things, please call us, okay? The other thing I want to emphasize is to get your flu vaccine. And make sure your children are fully vaccinated. Children 6 months and older should be vaccinated. And if it's the first year that they are being vaccinated and they're less than 9 years of age, they usually need 2 vaccines 1 month apart in the first year that they receive it. Why get a flu vaccine? Because it works. Is it 100%? No, it's not. Not much is in life, right? Not much is 100%, but it can save your child's life. Some recent research has shown that about half of the influenza deaths amongst children were among previously healthy children, and 2/3 of them that died were unvaccinated. So that's something that's that's an easy thing to do, just making sure that your children are vaccinated. I also think just a couple more things. I think it's really important to reassure your children that things will get better, because they will. And in the meantime, we just need to hunker down. And I think anything you can do to create a household filled with small daily celebrations like family meals, bedtime stories, singing, dancing, that is going to do a great service to your children in terms of decreasing their anxiety and any possible sadness that they might feel with all these measures, that seem very isolating. Limit screen time. I know remote school is crazy and challenging for both children and parents, but my recommendation is to limit screen times just to school, what you need to do. The rest, have more hands-on things. And then last thing, I recommend that if you're having trouble with feeling sad and anxious, or you think your kid is feeling sad or anxious or having problems with sleep, or if you're having trouble with affording, enough food because of lost jobs, reach out to us. I know we're medical, but we can help you connect with resources. So don't hesitate. Okay, we're here for you. Okay, all right, thanks.
Oh, thank you so much, Dr. McNally. That was great. So helpful to hear the info specific to children. We are now going to be we're going to be inviting one of our community members, Diana Luyuk, who's a Russian interpreter and refugee coordinator at Caring Health Center. I know she's pressed for time, and I would like to invite her to present her short spiel about why she believes in the flu shot. So, Diana, if you could unmute yourself and share your thoughts. Appreciate it.
Hello, thank you for having me. The flu shot is very important, especially for a kid, especially for a new refugee who is coming to United States. It's very important to get a flu shot. Even myself, I'm getting flu shot every single year because I'm in a close contact with people who I work, and I'm close contact with people who is having a flu. And this is the great things to do a flu shot every year, especially a new refugees who is coming to United States.
Diana, I welcome you to share your message in Russian as well, if you would like to do that.
Thank you. I would like to share my message in Russian to all Western Ukrainian, Moldovan and Russian community. Меня зовут Диана, я работаю в клинике Caring Health Center, я русский переводчик, я также работаю с беженцами в клинике Caring Health Center. Я хочу передать это сообщение жителям нашего западного Массачусетса, русской, украинской, молдавской комьюнити. В этом году я и моя семья будем праздновать День Благодарения, Рождество и Новый год только маленькой семьей, с самыми ближайшими родственниками, только из-за этой пандемии. Каждая семья должна понимать и осознавать, что для нас очень важно иметь здоровую семью и защищать наших бабушек, дедушек, детей от этого ужасного вируса. Пожалуйста, не собирайтесь в этом году большими компаниями и, пожалуйста, ограничьте размер вашей компании. Я очень хочу и желаю, чтобы вы все провели эти праздники без болезней. My name is Diana, and I'm working in Caring Health Center. I'm Russian interpreter and refugee health program coordinator. I want to deliver this message to community, including especially in Western Massachusetts, Russian, Ukrainian, Moldavian community regarding the holidays.
Thank you so much, Diana. I so appreciate you doing that. And I know that you are rushed to get to your point. So I just want to say how grateful we are that you've joined us.
Thank you. Thank you
very much. So we'd like to dive into the question and answer period now. And we want to thank all of you out there who provided these questions when you registered. Some of it will be, maybe a little bit redundant to what you heard, but I don't think that hurts to hear it again. And so the first question, actually, Narciso, I'm going to go to you. And people are really asking, first of all, you've spoken about how important the mask is, and that's great. Why is it important, and what is the best way to wear the mask and to take care of the mask? So if you could just perhaps share your response to that question. We received that question multiple times. Thank you.
Thank you for that wonderful question. Good afternoon once again. There's so many different masks out there. Really, the underlying message that I want to really reiterate and reinforce is everybody needs to have some type of face protection. I have a couple masks here with me. This one is the N95. I'm hoping you can see it. This one, I want to say it really should be saved and held out for healthcare providers, because we're coming in contact with patients who are much sicker. And if you think about it, in terms of virus and content of what they're giving out, it's much more virulent. It's much more much more concentrated is the word I was looking for, as opposed to everybody else who's happy and well and healthy and maybe asymptomatic who's out and about in the streets. So this is your regular surgical mask. This is the very easiest and simplest one that I can put out there. Usually they come with a little, like a metal type thing that helps you to sort of singe it around your nose. But the whole idea is, if you're going to wear a mask, the idea is you're breathing through your nose and then you talk through your mouth. Majority of the times when see people wearing masks, they either have it down here covering their mouth, or they have it around their neck, or it's hanging around. The whole point is, if I'm sick, if I'm the one that has the virus, if I wear this mask, it's called source control. So I'm keeping my germs to myself and protecting the person that's right next to me. The whole idea and premise behind social distance and keeping that gap between me and the person right next to me. Think about this. Good old days when your mother told you, when you cough, or your kindergarten teacher, don't just cough out into everybody, right? Because when you do, you have this wide array of things. You build a whole big sort of radius of germs that you spray out. That's why they always told you, cough into your elbow, not in your hands, because your hands are touching everything around you. So when you have, in essence, this mask, it helps to contain my germs to me. And I'm source controlled, and that way I'm only going to keep it. So if I'm sick and I'm keeping my germs to myself, I've protected the person that's going to be right next to me, because how often do those sneezes come? And sometimes you really aren't containing it. So this offers some level of filtration, so that even if it comes out, there's the barrier of the mask, and only very fewer particles are going to come out. And if, in addition to the mask, you are 6 feet or more away from me, it's going to dissipate before it gets to you. So here is the mask. I'm going to wear it just for 2 seconds to show what it is that I want people to do. This has the loops that you wear around your ear, and the idea is pull it below your chin so that your chin is encased in there and your mask. And you want to do that. Most standard masks really should provide that as a source of protection. I know there's tons and tons and different kinds of masks out there. I'm not going to negate that people shouldn't wear anything. At this point, any type of face covering is really appropriate and standard. Again, for us in healthcare, we are taking care of sick patients who need a little bit more care, that, whatever they're going through has become a little too much for them to handle it on the outside. And that's why for anyone that's in any healthcare environment, the surgical mask at a minimum is what is recommended, as opposed to the cloth mask. And then for those that are actively sick and we're needing to do other types of medical procedures, then we need the higher filtration, which is the N95. I've seen people out and about in grocery stores wearing them, and they have so many different types, but then you see that they haven't fitted it properly. They haven't. For all of us in the healthcare field, before we get to wear this, they do what they call a fit testing. So that makes sure that, because if I'm going to need this, I'm coming in contact with very high concentrations of that virus, and I need the best filtration so that I can protect myself. So think if I was going to do a bronchoscopy or whatever test it is that was going to aerosolize all those particles, I needed the high filtration, and that's why they'll do the fit testing to make sure that it appropriately fits me for the task and the job at hand that I'm going to do. So
Nurse Ivoso, I have a question for you with regard to those cotton masks that people in the public wear.
Yes.
Can they just wash those at home quickly with soap and water and dry them off?
Absolutely.
Okay.
Launder it with just soap and water, because the one thing you will remember, this type of a virus is the easiest one that we can get rid of. It's non-enveloped and just simple soap and water for
Thank you. Thank you so much. Thank you so much.
Yes.
All right. Our next question is for Dr. Del Pilar, how long does the COVID virus stay in our system even after we've been tested?
So let's say I get tested today and I'm positive and I have a fever and have a little bit of a cough. The studies show that for the next 10 days, you'll have enough virus coming out that you can actually infect other people. After 10 days, we haven't had any evidence that you have live virus being shedded. So after that time period, you can't really infect people. The difficulty is that you can still have some of the genetic material of the virus shedding from your nose. So for the next 3 months, give or take, the test could still be positive, but doesn't mean that you are infectious. It just says that your body is getting rid of pieces of that virus from your nose, and that's what we're picking up in the test. So short answer, for the next 10 days after you have a positive test, you are considered infectious. After that, if you're otherwise doing well and recovering, you should be okay. The only exception will be that if you're immunosuppressed, like persons with HIV, on prednisone, organ transplant patients, those patients actually we extended to 20 days rather than 10 because they can shed the virus longer because their immune system needs a little bit longer to kind of get rid of it.
Okay. Wow. Great. Thank you. So now I'd like to invite Miss Ebony Steed, who's part of the Young Women's Initiative. She is going to unmute and share her 60-second story about wearing a mask.
Good, how are you? Hi, everyone. So my name is Ebony, for those of you who don't know. I am from Springfield, Massachusetts, but I do live in Connecticut at the moment. As you can see, I am wearing my mask. I am at work trying to protect my friends and my coworkers from getting sick. Just want to emphasize everything that everyone else has been saying, that how important it is for everyone to wear a mask and how easy it is to get sick. Recently I did have COVID myself, so it was very hard to make sure my family stays safe and make sure that my friends stay safe. It's something that we all have to be selfless about. It's so easy to say, well, I've been in the house for a month and I like to go see my friends, or I just want to hang out. But we have to take the time and take it upon ourselves to stay and to stay home. We all have to wear our mask, and we all have to be proactive in making sure that we can find the end to this virus and make sure that we can get back to normalcy as soon as possible.
Thank you, Ebony. Thank you so much for taking your break from work and being responsible and wearing your mask.
Yeah,
all right, thank you. So moving on to the next question. This is for you, Dr. McNally. We received questions about how can we best support young people, both kids who are not in schools and their mental health? How can we best support young people today during this pandemic?
Yes, I mean, such an important question because, we know that the children with anxiety, the number of children experiencing anxious feelings, sad feelings, feeling isolated, has surged, since the pandemic started. I think the most important thing is a sense of routine that is above and beyond just the remote school stuff. So I think again, I mentioned it in what I had said initially. Making sure you have sit down with family meals, cook with each other, read to each other, and try to get physically active. Also, we've also seen a real increase in levels of weight gain during the pandemic. Not just I've gained my 20 pounds during this thing, but I think children are also experiencing the similar concerns, and we just want them to stay as healthy as possible. So I think cooking with each other, cooking and eating together, and stressing healthy eating instead of stress eating. I think those are really important things. And again, I think celebrating the family, the household, and having events that do celebrate that, and trying to go outside. I think that's really important. A lot of kids are being locked up inside. We are in a pandemic. You do want to be careful about getting really within 6 feet of people, but you can still go outside. Wear the mask, go outside, get some exercise. I think that can really help with sleep-wake cycles, and just make people less stressed out. And I think, and the other important thing is that if it continues to escalate, if you get worried as a parent, you get worried about your kids, at any point, call us. That's the most important thing, because I think the earlier we can intervene, the better.
Thank you.
Because everyone is experiencing the same feelings.
Yeah, thank you. Thank you so much. And that was a very important question. Now I'd love to open it up to State Representative-elect Pat Duffy of Holyoke. I know she's there in her office. Pat, if you wanted to talk about the flu shot.
Absolutely. Yeah, actually, to tell you the truth, Rep. Vega and I are cleaning out his office. So yeah, it is so important for the reason all these medical experts discussed. Getting a flu shot is so important and so easy. My husband and I, we just went to our regular pharmacy. It took 2 minutes, and we did it, and we're protecting not only each other, but our coworkers and their families. So I just can't stress the importance enough.
Okay, thank you. And we're going to come back to Rep. Vega in a few
minutes. Because
now we'll come back to you. Now I wanted to invite Cherise Burston, who's a community health worker at Caring Health Center, to also share her story about getting a flu shot.
Hi, everyone. Yes, I am a community health worker at Caring Health Center in our Women's Health Network program. And I got the flu shot to protect myself and others. Like many in my community, I was afraid, but I couldn't let the fear dictate, my health and well-being. So I went and scheduled my appointment for a flu shot, got vaccinated. And it hurt a little. However, I didn't want, the benefits outweighed the fear, and so I just want to be an example to those in my community that it's okay to get a flu shot.
Oh, thank you so much, Cherise. Thank you for sharing that. And I think I'm going to leap to a happier message. Miss Ethel Griffin, if you're there, co-director of Revitalize CDC, I'd love for you to share this of how you're going to celebrate Thanksgiving this year.
Okay. Good afternoon, everyone. I thank God that we're still here. This year, we usually every year we get together. It's usually about 14 or 15 of us get together naturally at my house because I'm the one that does all the cooking. But this year, we all agree that we are going to be sitting down to eat at the same time, but it will be at our own home. And what I am been selected to do the cooking, but at a certain time I would call them. Everybody, I would pack boxes for each family to have. When it's time for that person to come, we'll put the box in the car, and they come over and they get the box and they take it home. I have a daughter with her family and a son with his family. And I have the son in Maryland, which I won't be cooking for him because he's all the way in Maryland and his family. But what we're going to do, they're going to go back, and at 3:00, we're going to all sit down and eat together, but we'll be at their own home, and we'll pray together. So this way, we are not in contact with each other. It's very difficult, because for the last 50 years, this is what we have been doing. But we realize that it's important because we have people of all ages. We have young children, teenagers, middle age. We have old people like my husband and I. So this is how we are going to celebrate. We will not be coming in contact with each other. It's hard, but it's something that we have to do. It's important. And we are also, while we're sitting down after prayer, we're going to make plans for next year of how we're going to be sitting down together.
That's so beautiful. Thanks, Ethel. And how lucky that you're doing all the work.
Yeah.
So thank you so much for sharing. And next, I want to jump to Ed Case. He's in the Hampden County Sheriff's Department and is the Holyoke Safe Neighborhoods Initiative leader. Ed, can you talk about how you're wearing your mask? And
good afternoon, everyone. With the recent spike in positive COVID numbers, now more than ever, wearing a mask. Am I on mute? No.
Nope, you're good.
Okay,
you're good.
Now wearing a mask is more essential than ever. It's also a time for each of us to do our parts in preventing the spread of COVID. Each of us can be part of spreading awareness through sharing information with our families and friends via phone calls, emails, FaceTime, or social media. We can participate in wearing a mask, applying social distancing practices, and treating COVID as a serious threat to our community. Today, we ask you to share what you learn about preventing the spread of COVID with your family, friends, and coworkers. We believe that if we all work towards better prevention, we can be part of a team keeping our families and loved ones safe and healthy. On behalf of Sheriff Kochi and the entire Hampden County Sheriff's Department, we wish you, your families, a happy and safe Thanksgiving. Thank you.
Thanks so much, Ed. That was great. Rep Vega, can we bring you back and you can share your story about Thanksgiving?
Absolutely. Good afternoon, everybody. Nice to see everybody. It's been a long 10 months, so to speak, as we look back. But I just want to say now is not the time to be a wild thing. Now is the time to use your hand sanitizer, right? To wear your mask, even when you're in public places with people you don't know. But, we're all zoomed out. And we're on the Zoom right now. People are watching on YouTube or watching through Facebook. If you can't get your dinner from Ethel this year and get that pickup dinner, invite your friends in for an appetizer. Have them on Zoom. You don't need to be looking at the Zoom the whole time. They can be at your table, right? Invite them in for a cocktail. Invite them in for dessert. Now's not the time to travel. Save your money on traveling. Put it towards a good donation to the Food Bank of Western Mass or any of the many great organizations in Western Massachusetts. But I think the time is to be close with the people that are in your home, be close to your home, be close to being safe, and utilize Zoom in a different way. Maybe have someone play music, have someone do a little dance party. You don't have to be all in the same space to connect. So stay connected, but stay physically distant, stay physically safe this Thanksgiving. And again, if you want to have a happy wife, make sure you get your flu shot. And make sure you do that because your son's got to get one too if they're in school. So be safe, get your flu shot, wear your mask, and have a great Thanksgiving.
Thank you. Thank you so much. Appreciate that. I'm going to jump back into the question scenario because I do want to honor some of these excellent questions that I'm sure many of us are thinking. So back to Dr. Del Pilar. Question came in about strains of COVID. Will there be a strain of COVID like we see with the flu? And can it mutate itself?
So a lot of people don't realize that there are actually like 3 strains of COVID going around the world right now. by geographic location is actually what predominates. And we have one here in the States and the Americas and Europe. There's another one that's a little bit different over in China and Southeast Asia. The virus seems to be very, very stable, and we're not expecting it to be changing so quickly as we see with the flu every year. Obviously, we're still learning a lot from the virus, so it's possible that this statement might change in a few months or a few days even. But with the information that we have right now, it doesn't seem that this is a virus that changes from today to next month. And the good thing is, if kind of tying this into the vaccine that might come in the next few weeks, perhaps a month or two, the protein that is attacked in the vaccines is actually preserved through all these different types of the COVID that we have seen so far, and actually extends to some other strains of coronavirus that are not COVID. So the vaccine should still work, even if there were minor mutation, because these big proteins don't really change. It's like, we all humans have heads. If we don't have heads, we're not humans. So if you target the head, you're going to get a working vaccine.
Okay, thank you. And Nurse Iboso, we have a question from someone around disinfectant. What is the best type of cleaning disinfectant to use in your house or your car?
The CDC generally has a link, and it's any, they have it on what do they call it, EPA list, but they have a list of all the appropriate disinfectants. I know everybody was looking at it to see, is it effective against COVID-19? You have to remember, this is new. So they wouldn't have tested anything against it because it didn't exist 2 years ago. But anything that, as Dr. Delpla has said, if it was effective on the listing or on the active ingredients, if it says that it's effective against any of the coronaviruses, it should be sufficient. But really, at the end of the day, even just good old soap and water. The idea is your commonly touched surfaces, and then really, how good are you about washing your hands? That's got to be the key and the most important takeaway out of everything. It's your door handles, it's your light switches, but truly, it's are you great at washing your hands when you come home from the supermarket or from whatever, or teaching your kids when they use the bathroom to wash their hands? Because we're also focused on disinfecting all those surfaces, but it's what are you doing while you're out there? Are you touching things and then touching your face and touching your nose? And when you do come home, what's the first thing you do? Is it washing your hands or going to touch all those things? Because if I'm touching my hands the minute I walk into my house, then I'm not worried about what it is that I touched out there and bringing it into my home. So I know we all have seen this shopping frenzy. Number one, it was the toilet paper, and then it was all the disinfectant. When you go into the grocery stores and the cleaning and disinfectant aisle is completely bare. And I'm thinking, how much cleaning is everybody doing, So truly.
So keep it simple.
Yes, I just want to reinforce everybody should be washing their hands and washing them often. And then really throw soap and water.
Okay. Thank you so much. So wash our hands, soap and water is the best. I would like to jump now to Miss Azel Kavan, who is the Chief Communications Officer at Springfield Public Schools. Azel?
Hi, yes, thank you. Thanks. I just wanted to hone in on three things, really. Everyone's been talking about the flu shot and how important and how great that is for protection. But I wanted to remind people that in 2021, the flu shot is actually going to be a requirement for enrollment in Massachusetts schools. And so just as all of the other immunizations must be met for enrollment, the same is going to be true for the flu shot for students beginning in 2021. So please keep that in mind. I also wanted to give a little mental health tip because remote education has proven to be tough on students and teachers and parents and families. And as I've been going about and talking with families and teachers about what they're doing in their homes, I've heard a lot about Fun Fridays. And so it's a way for parents and families to celebrate getting through that week. Just knowing that on Friday, they're going to do craft together, or they're going to have a special meal or just something fun on a Friday. And I've been speaking with families that have been doing that consistently since we started school remotely. And they say it just helps to really get them through the week. And then lastly, I just wanted to remind folks that Springfield Public Schools has a meal service that is available where we provide breakfast, lunch, dinner, and a snack for families, not only Springfield Public School families, but in the surrounding areas. We serve those meals at several locations. It's on our website, which is www.springfieldpublicschools.com. And we know that a lot of families are facing hardships due to COVID and maybe a loss of job, or a temporary cease of some sort of income. And so these meals, we've served close to 5 million already since the pandemic first started. And I want to remind people that it's out there and available.
Oh, thank you so much, Azelle. That's great information and terrific overview of everything the schools are having to do. I want to jump back to Dr. Del Pilar and just ask you very quickly. Unfortunately, it's already time to wrap it up. But can you talk a little bit about the hardest hit communities, particularly the high risk communities, and what outreach is being done for those folks?
So looking at the people that have been affected by the pandemic, you see that is the typical people that get affected by almost everything in our society, particularly minorities. If you look at our Black and Brown communities, we've been hit pretty hard for a plethora of reasons. We've had started some community outreach. I think Yemisi is on the call and she can speak more to this than I can, but it has involved full discussions with community faith leaders, because you listen to your pastor more because you trust him more than this person that's coming from the hospital. Making sure that we go out, Dr. McAdoo goes out with this bus and they present this information and let people ask questions, orient people about the importance of the flu vaccine. When COVID vaccine is available, what would that look like? And, it's all about trying to build the trust that we can create within the community to make sure that when we have these tools available that we use them. And I know, being a Puerto Rican myself and growing up in the island, that sometimes there's always a little bit of mistrust of, they're making these things in this back lab, God knows where, and they want to experiment on us minorities. And I can tell you that being on this side of the aisle, that's not what's happening, and that's not what we want. And, BASA will be the first institution to tell you that if the data for the vaccine is good, reliable, we'll endorse it and we'll get behind it. If the data doesn't support that it's safe for everyone to use, we'll be the first one to say, we're not doing this. So we are having community reach out to make sure that we engage these communities, giving them all the information that we can. Again, these are all tools that we can use to reduce your risk of actually getting COVID, whether that is how to use a mask, how to clean your hands. There are very, very nice videos even for kids. There's actually a Sesame Street one about cleaning your hands on YouTube. Social distance, the CDC high guidelines of if you're looking at having a holiday celebration with family at your house, you probably should avoid it. But if you're going to go through it anyway, these are the things that you probably do. So visit the CDC website, get all the information, try to keep yourself, your friends, your family, your coworkers, your neighbors as safe as you can.
Okay, thank you so much. And I know that someone is saying that we need to share the COVID hotel system telephone number is 617-367-5150. And we will have these resources on our website, www.publichealthwm.org. So we'll have a listing of testing sites as well as some of this other information. Now I just want to go over, we have State Senator-elect Adam Gomez. He wasn't able to join us tonight, but he did create a video message for us, and I'm hoping we can play that right now.
Hi, I'm State Senator-elect Adam Gomez. As we head into this winter, here are a few tips on making sure everyone has a happy and healthy holiday season. Number 1, stay home and wear a mask and practice social distancing if you have to go out. Number 2, avoid large in-person gatherings. Keep indoor celebrations to a 10 or fewer people. And make sure everyone is wearing their mask and practicing social distancing. Number 3, get your flu shot. It may not prevent COVID-19, but it will help making sure that our hospitals have the capacity to provide the care our community so desperately needs. The sooner we follow these tips, the sooner we can overcome this pandemic, and the sooner we can go back to spending our holidays as they are meant to be, with our friends and our loved ones, without fear. Lastly, I want to thank you and happy holidays from my family to you. Thank you so much and happy holidays.
That was great. So I feel like there was so much worthwhile information shared tonight from expert folks who are on the front lines and just community leaders and folks doing the everyday good work of sharing their beautiful messages for how we can all stay safe. So thank you again so very much. We are grateful to all of you that you took the time to watch and listen. To stay informed and stay safe. We will be leaving you right now with a 60-second video from Healthcare Heroes Everywhere. And just want to say from the Public Health Institute of Western Mass, thank you so much. And we hope that you enjoy your holidays being grateful. Thank you again, everyone. Have a wonderful evening.